So RS is a 24-year-old female veteran with a history of hypothyroidism, traumatic exposures during her deployment, and a childhood history of ADHD, who presents with suicidal ideation and progressively worsening anxiety and nightmares since returning from deployment 1 year ago. Since returning home, she said that she's been waking up 2 to 3 times per night with palpitations and vivid nightmares related to her experiences in Afghanistan. It now takes her several hours to fall asleep each night because she's afraid that she'll have more of these nightmares. She also reports significant anxiety about driving. She says that she's been avoiding getting in cars or driving cars because underpasses and roadside litter make her really anxious. And she describes some panic-like symptoms, palpitations, sweaty palms, and shortness of breath. She said that in order to help relieve these symptoms, she has to pull over to the side of the road before they'll go away. She also always feels like she's on high alert while she's driving and can never really relax. She said that she's never had any experiences like this before her deployment, but that it's been getting worse since she returned. She works as a campus security guard and actually has to drive for her patrol route, and so this is starting to interfere with her job, and she's starting to get nervous that she might actually lose her job because of it. And having those thoughts now makes her feel guilty because she's afraid that if she does lose her job, she'll become more of a burden for her husband. So especially related to that, for the last 2 weeks, she said that she's been feeling just overwhelmed by the symptoms that we just talked about. She said she just doesn't want to deal with it anymore. And during this time, she said that she's actually felt like dying might be the only way to get relief from these symptoms. And she hadn't made any specific plans, but yesterday in the evening, she said she started thinking about jumping out of the window of their 5th floor apartment, and having this thought actually scared her. So she went to her husband. She told him what she was thinking about, and he brought her to the emergency room. Currently, she describes only passive suicidal ideation, but she says that if she leaves the hospital, she's afraid that these thoughts will come back and she might actually act on them. She denies feeling depressed prior to the last 2 weeks, but she does note that she's been snapping at her husband more and more frequently, and she hasn't really enjoyed doing some of the activities she normally does, like running. She also reports some fatigue during the day, trouble concentrating in school. She denies any changes to her appetite or weight, any homicidal ideation, any self-injurious behavior, paranoia, manic or psychotic symptoms. Her past medical history is significant for hypothyroidism. She takes levothyroxine 200 micrograms every morning, and she was treated for ADHD as a kid, but hasn't required any treatment since before high school. Her only other medication is an oral contraceptive pill. She also has a history of some concussions. She had a concussion that she knows of when she was 16, but she also describes some symptoms that are consistent with a concussion from an explosion during her deployment. She's never seen a psychiatrist or a counselor. She's never been in psychiatric care or had any psychiatric hospitalizations, and doesn't have any past suicide attempts. Her family history is significant for a mom with anxiety and a father with depression, and no one in her family has ever attempted or committed suicide. Her social history: she served in the military for 4 years with 1 deployment to Afghanistan. She now lives with her husband. She works as a campus security guard and takes classes at the community college. She denies any use of tobacco, alcohol, pills, prescriptions that aren't prescribed to her, heroin or cocaine. Her review of symptoms was pretty unremarkable. Specifically, she said that she had no fever. She's had no fevers, chills, sweats, chest pain, edema, no nausea, vomiting, diarrhea, abdominal pain, no constipation, no changes to her stool or blood in her stool, no changes in the texture of her skin or hair, no headaches or dizziness, no easy bruising or problems with wound healing, and she has a regular menses with normal flow. For her mental status exam, she's a neatly groomed 24-year-old woman wearing casual clothing who appears her stated age. She was alert, cooperative, and oriented to person, place, and time throughout the entire interview. Her eye contact was appropriate, her speech was fluent, but a little bit hesitant at times. She was fidgeting, and a few times she jumped at loud noises that were coming from the construction site across the street, especially if they were like loud or sudden. Her thought process was linear and coherent. She described her mood as nervous, and I would describe her affect as anxious, and at times a little bit guarded, especially when she was talking about triggers for her symptoms. She reports passive suicidal ideation. She thinks that dying might be easiest is the word that she uses, but has no specific plan. She endorses hopelessness and cannot articulate a clear plan for the immediate or long-term future. She denies any homicidal ideation, visual or auditory hallucinations, paranoia, or ideas of reference, and her insight, judgment, and impulse control are all fair. On physical exam, her vital signs, her heart rate was 60, her blood pressure was 125/80, respiratory rate of 14, and a temperature of 98.9. Her general appearance, she appeared a little bit nervous, but in no acute distress. HENT, her conjunctiva were pink, and she had a little bit of pallor. Her neck, I didn't appreciate any thyroid nodules or enlargement. Her cardiovascular exam, her heart was regular rate and rhythm with no murmurs, rubs, or gallops. On pulmonary exam, her lung sounds were equal and clear bilaterally. And skin exam, there was a little bit of pallor to her skin, but no evidence of alopecia. Her hair is a little bit coarse and a little bit dry, and I didn't appreciate any pretibial myxedema. So for assessment and plan, in summary, RS is a 24-year-old Afghanistan veteran who presents with suicidal ideation and 1 year of worsening nightmares, anxiety, and panic symptoms after returning from deployment. The correlation and timing of her symptoms with returning from Afghanistan, the nightmares of traumatic experiences, her panic symptoms and hypervigilance, and her avoidance of sleep and driving, I think are all consistent with a diagnosis of post-traumatic stress disorder. Her depressive symptoms and suicidal ideation are probably more multifactorial. It's a little bit hard to tell if some of her symptoms, like her daytime fatigue and poor concentration and restlessness, have more to do with like underlying depression, or if it has something more to do with her symptoms of trauma and the kind of side effects of that. But I think we'll probably need to target both depression and trauma to help her feel better. I think she's also particularly at risk for some of these depressive symptoms because of her history of concussions. So considering her suicidal ideation, and especially the worry that she might not be safe when she goes home, I think she does require continued inpatient hospitalization at this time. So, and we'll need to target both her trauma and depressive symptoms. So I think my plan at this point would be for her to remain inpatient for safety and stabilization, as well as initiation of some medication trials. I think we can start her on Prazosin for her nightmares, that we could start at 0.5 milligrams before she goes to bed at night, and hopefully that'll help her with the nightmares. And then I think she might also benefit from starting an SSRI. So we could start Zoloft at 50 milligrams in the morning. We could start that tomorrow morning. And then lastly, I guess I would just do a couple of labs. Considering her physical exam and her history of hypothyroidism, I think we should do some thyroid function tests and make sure that everything's okay there. And then because of her pallor, I think we can do a CBC and check for anemia. So that would be my plan for now.